Canada's food guide.
For more than half a century, it's been our guide on what to eat.
It was last updated in 2007.
So yeah, pretty outdated.
And given what we know now in 2019,
Some of the advice in that guide could be harmful.
so this year it's getting an overhaul.
The undertaking is huge.
The cost is high.
So is it worth it?
Is it worth it?
Is it worth it?
I'm Lennox Wong, Chief Medical Officer at the Hospital for Sick Children in Toronto.
I'm Danielle Martin, family physician and vice president at Women's College Hospital in Toronto.
I'm Sean Wharton, internal medicine specialist and medical director of the Wharton Medical Clinic Obesity and Diabetes Center.
And my biggest problem with the food guide is that nobody even knows what a portion size is.
Is that it's been tough for families to interpret and carry out.
It's trying to prescribe one dietary measure for all Canadians, and that's not possible.
Okay, now, one thing that all of our panelists have in common, I think, is that they all believe the Canada Food Guide, as it exists today, is problematic, but maybe more importantly, that the consequences of a bad food guide ripple out far and wide. So I want to start by just doing a quick go-around. If I could ask you if you even use Canada's Food Guide in your practice. Danielle?
I don't.
Lennox?
No.
Sean?
Currently, no.
No, okay. So Danielle, why? I mean, what are specific things in the food guide that you think are so problematic?
Well, you know, the food guide talks, for example, about juice as an alternative to fruit, which I think is really problematic given the sugar content in juice. And it also talks about portion sizes as though normal people go around with measuring cups and, you know, scales measuring the amount of food that they put onto their plate. And so it's not a very user-friendly way to talk about healthy eating. As important as that conversation is, I think there are more effective ways to have it.
But I mean, isn't the simplicity of it one of its appeals? I mean, Sean, you know, I think even just as an approximation, the notion that, hey, maybe we ought to have a balanced diet of meat and fruits and vegetables and dairy and milk and grains. Isn't there value in that?
Not when there's no value in the simplicity or the reductionist theory of that, because what happens a lot of times if you're looking at disease states such as obesity and diabetes, for instance, which is what I deal with most of the time, the food guide doesn't work for that because it is too simplistic. It's too reductionist. It doesn't help me for my patients who are very specific and need specific types of guidelines. So it tries to reduce everything into this is what you should do, when in fact there's multiple things that people have to do. So I think that's where some of the problems are.
And Lennox, I'm seeing you nodding as you're listening to Sean speak. I mean, is that one of the problems in your mind of the food guide, that it purports to be the sort of one-size-fits-all approach?
Yeah, so the positive is that it's a start to a conversation, and so you can start to have conversations about groups of food. The problem, I think, is that it can lead you to the wrong conclusions, and so people start to think that a slice of bologna is the same thing because it's in the same food group as chicken breast that's been grilled. And these are incorrect conclusions, and I think that could lead to some unhealthy eating habits.
Would you go so far as to say that the food guide, as it exists right now, is harmful? I mean, is it doing more harm than good?
I think it reflected the understanding that we had at the time that it came out. But our understanding has changed. You know, the evidence has changed, research has evolved, and there's a lot that we know now that we didn't know 12 years ago. So I would say it's sorely due for this update. And I suspect that if we think about how people can, what we know now about what can guide behavior and in healthy living, we know a lot more about what motivates people and how we can support people in making healthy choices. If we apply some of that evidence, not just the evidence about this nutrient or that nutrient, to the way that we frame the food guide, then I think, you know, your point about conversations, Lennox, is a really important one. It will allow us to have more productive conversations, not just in the doctor's office, but in our schools and elsewhere.
Sean, but what do you think in terms of the relative harm versus the relative good of the guide as it stands?
Right. So I think that what the guide is there for, it's there to give us a little bit of guidance when you're in the grocery store, when you're at a school. So we're looking at preventative measures. We're looking at what you would look at on the grocery shelf as being a healthy item versus a non-healthy item. So if it's going to give us some guidance there, it should do a better job than it currently has.
So let's talk about then some of the potential changes that we might see, because we've seen some drafts, we've seen some proposals in that sense of what we can expect in the spring. And so, you know, one of the things things is the shift towards plant-based proteins, and necessarily that means a shift perhaps away from meat, away from dairy. So there's a lot to tackle there. Lennox, maybe we start with the dairy side of things. So, I mean, I always think of dairy as being a source of not just protein, but calcium. Right? So if there's less prominence on dairy, where do you get your calcium?
Yeah, so it's true, dairy is a fantastic source of calcium. There's no taking away that quality from dairy. But there's a lot of other sources of calcium in our diet. So we get plenty of calcium from green leafy vegetables, as an example. And it's important that we have a bit of that balance and that people don't see one particular food as the sole source of one particular nutrient.
Another proposal that we've seen is a shift away from meat as a protein. What are your thoughts on that?
Well, what my understanding is that what we're going to see is meat going into a larger kind of protein category that will include, other things like lentils and, chickpeas and tofu and, cheese and other eggs, other forms, good sources of protein, some of which come from animal sources and some of which come from plant sources. And I think Lennox's point about the bologna is a really important one, because meats that are highly processed, have nitrates in them and have added fats and sugars and chemicals put into them. It's not the same as a chicken breast.
But even if you set processed meats aside, I mean, if the exclusion of meat as its own food group, is that a decision that's driven out of health concerns, or is it driven out of environmental concerns, which is a whole other thing?
I think it could be both. And I think the other thing is to understand, and Sean's the obesity expert here, but that living a healthy lifestyle and maintaining a healthy weight also isn't solely about what you eat. It's about other choices that we make in our daily lives. And so we can't kind of siphon these things off and have them be exclusive. We have to look at them, in the broader spectrum.
There was a statistic that suggested in 2017, 64% of Canadians reported as overweight or obese. As we talk about Canada's food guide and how it might relate to that problem, how it might be instrumental in solving that problem.
If we're looking at obesity, we know that refined carbohydrates have been a big challenge. So we have looked at fat as being the major problem for a long, long time, and that was a mistake. So I think we're moving away from saying that fat is the problem, and we're looking more towards saying that the refined carbohydrates are causing more of a challenge. But that doesn't mean that we're getting rid of all carbs.
Right.
So we're moving more towards protein, towards fibers, and less from the refined carbohydrate. And what Danielle was talking about as well was maybe some of the behaviors that we have, some of the stressors and the emotional eating and some other factors in our lives that contribute to excess eating, even addiction type of eating. So all these things have to be factored into why Canada is such an elevated weight and why the treatment of weight is so challenging.
You talk about the relative importance then of diet when it comes to weight loss and when it comes to obesity. I think of kids in particular. Does that present its own kind of challenge, or do you have to think about it differently?
Well, I think we think about it very similarly. In fact, one of the few things we know is that about our current epidemic of obesity and overweight adults is that it starts early. It starts in childhood. So right now, it's a third of children in Canada are either overweight or obese. Now, we don't know all the factors that go into that, but what we do know is that diet forms a part of this, the types of food we eat form a part of it, and activity. And for kids, that's play. So if we have environments that don't encourage play, that don't allow kids to go out there, enjoy, have fun, and really, to the best of their ability, improve their own health, then that's going to contribute to the obesity epidemic.
So as we wrap things up then, in what ways would you like to see the Canada Food Guide be revised so as to, I don't know, potentially be able to reverse the trend of obesity in this country over the next generation or few generations? What is it that you would want to see? I
would love to see an emphasis on eating foods that we prepare ourselves, that come from actual, as Michael Pollan would say, what your grandmother would have recognized as food, eaten together, as much as we can amongst friends and family, because I think that also speaks to the social role of food and to the need to make sure that healthy ingredients are affordable and accessible for Canadian families.
I want to go around the table on that. Sean, maybe I'll ask you.
Yeah, I think we need to eat whole foods. We need to cook as a family. We need to understand eating as an enjoyable aspect. We need to understand the social factors, emotional factors, and the health factors. So not just the reductionist kind of levels that we've looked at. What is a calorie? What is it going to do to weight? But how do we eat, and what should we be eating to try to be as healthy as possible? And that's a little bit of a different dialogue.
And Lennox, I mean, the food guide, kids are learning this in school. That was my first interaction with this, right? Learning about the 4 basic food groups. What is it you would want to see in that vein?
I'd love to see our food guide reflect the multicultural nature of our country. So a lot of the foods that we have on our tables at home look different than what might appear in this rainbow chart of food that's broken down into the individual bits and pieces. So things that actually reflect meals of where we come from, whether it's from Asia, whether it's from Africa, Europe, or if maybe your family's a multi-generational Canadian family.
Right. If I have a bowl of chow mein, what does that mean, right?
Exactly.
In terms of the food, how many servings of what are in there.
Exactly.
Really fascinating conversation. Thanks so much, guys, for coming.
Thank you.
Thank
Our
you.
pleasure. Thank you.